All right. Good morning, everyone. Thank you so much for joining us today. Hope you can all hear me okay. My name is Diana. I'm the Vice President of Account Management at Daybreak Health, and I support Daybreak's partnerships with school districts across the nation. We have a few more folks joining us today, so we'll get started in just a minute with our discussion with San Diego Unified and Yuka Sakamoto, who's joining us to share more about our program. But we wanted to get started by sharing just a brief introduction to Daybreak. If this is your first time hearing about Daybreak, we'll also hand it over to our panelists for introductions, then we'll dive into our discussion. So Daybreak is a school-based mental health service provider. We partner with over 100 K-12 districts across the country, and our mission is to break barriers to mental health care so that every young person can benefit from mental health support. Every district partner that we work with shares that mission, and with our partnerships, our programs are now available to over 1 million students across the country. As I mentioned, I'm the Vice President of Account Management at Daybreak, so I work very closely with our districts in helping to implement both on-site and teletherapy programs at scale. We have the distinct privilege today of speaking with Yuka Sakamoto, the Program Manager of Mental Health in San Diego Unified School District. We'll start with some introductions. Yuka, can you share a little bit about your role with the audience? And then I will pass it over to Alex Kaiser.
Will do. Well, thank you for having me. First, I just want to say thank you. Thank you for the nomination. Thank you for the award. As a district, we really appreciate that recognition and appreciate your ongoing partnership. So as you mentioned, I'm Yuka Sakamoto. I'm the program manager of the Mental Health Resource Center in San Diego Unified School District. And I've been with the district for 15 years, 4 years in my current role as program manager. And prior to that in the district, I helped to oversee as a clinical lead, some of their day treatment programs, as well as the supervision of the county contracted programs. Prior to my time with the district, I've been working within the community-based mental health field for about, well, in total 27 years, so 15 of that in the district. And in that time, I worked with community-based organizations that provided EPSDT Medi-Cal services, as well as within programs that offered residential services to students or to children who are involved with the child welfare system, as well as the delivery of mental health services within the probation detention facilities. So that is my experience.
Wonderful. Thank you, Yuka. We're excited to learn from you today and to learn more about your background and how that has informed some of the programmatic decisions you've made over the years in San Diego as well. Thank you for sharing that background with us. We're also joined by Alex Kaiser. Alex is our Director of Clinical Growth and Care Operations at Daybreak. Alex, can you share a little bit about your background and your role with the organization?
Yeah, absolutely. Thank you. So I have been at Daybreak for just over a year now, and I was brought into Daybreak to help scale the clinical operations, specifically to help scale the number of quality therapists that we have here to meet the growing referrals and the growing number of schools that we partner with. So we've been able to do that and grow by quite literally hundreds of clinicians now in the past year, and able to scale directly with the amount of referrals that we're seeing, so that we're able to get the kids into care quickly and get them into care with clinicians who are representative of their backgrounds and the cultural sensitivities, and also clinicians who are highly trained in school-based or CMH settings or similar settings where they've worked heavily with youth and with families and guardians and parents. And prior to that, held a similar role. So I've been doing clinical recruitment for probably about 6 to 7 years in total now, doing the same at a previous group, so scaling from just a few clinicians to several hundred. And it's been great to watch the growth here at Daybreak, and just the true focus that we have on clinical quality and ensuring that we have the right clinicians in the right seats to help the kiddos.
Thank you, Alex. I appreciate you sharing that introduction, and we're excited to learn from you today around some of the qualities that you're looking for when you're building up the clinical team at Daybreak, and how you think about the communities that we serve when you're looking at the profile of different clinicians who can best serve each of our communities. We're also joined by one of our clinical supervisors and the on-site program lead at Daybreak Health. Ashley, can you share a little bit about your background and how you support our clinicians at Daybreak?
Yes, good morning, everyone. I have been a practicing clinician since 2010, so coming up on 15 years now. Majority of my experience is with children and adolescents, specifically school-based therapy. Prior to working at Daybreak and while I was getting my doctorate, I worked in North County, San Diego, in county programs. I worked in EPSDT program, and I also worked in a program that served children age 3 to 5. I have been at Daybreak since 2022. I came on as a clinician at Daybreak and quickly became a clinical supervisor for the San Diego Onsite program. And so I've been doing that for the last 2 years. This will be my third school year. And this year we're super excited. Daybreak has expanded our Onsite program to not only include San Diego, but 2 other districts in California and 2 in Texas as well. So it's super exciting to take everything that we learned from starting our program in San Diego Onsite to these other districts too, and be able to serve more kiddos. So.
I love that, Ashley. And I totally agree. And it's one of the reasons we're so excited to have Yuka here with us today to learn about how we set up programs for success and really make sure that we're learning from innovative and thoughtful solutions for incorporating on-site programming at scale. All right. Last introduction, we have the lovely Erin Weaver joining us as well. And Erin will be supporting our conversation and the chat as well. Erin, could you share a little bit about how you'll be supporting our conversation and your role at Daybreak?
Yeah, hi, I'm Erin Weaver on the school partnerships team here at Daybreak Health. Have been doing this for about 2.5 years. And I actually came from, prior to that, programming documentary screenings with schools on the intersection of education and mental health. So I love working with educators and administrators on coming up with solutions together for youth mental health, and was part of the selection process for awarding just 6 of our over 100 district partners as Mental Health Innovators this year. So I'm very excited for you all to hear directly from Yuka today about her work and San Diego Unified's programs. So should any questions come up as we go along, please feel free to use the chat and I'll get back to you. We'll try to save a few minutes for questions at the end too, but we'll do our best to get to questions as they go along. So don't be shy. And it would also be great to see who's here. So you are welcome to use the chat to introduce yourselves and let us know where you're joining from. But thanks again for being here and really excited to hear from you all on the panel.
Thank you, Erin. And as Erin mentioned, and I shared this at the start of our conversation as well, we recently launched the Mental Health Innovators Award. And for those who are hearing about that program for the first time, we have 6 recipient districts that were part of what we're calling our inaugural group of innovators. The program itself was inspired by a lot of the work that we see on a daily basis, which includes the innovation, the dedication, and the creativity from district administrators, school counselors, educators, school psychologists. So today we're spending time with Yuka, learning about San Diego Unified's on-site program, and specifically the way that Yuka and the San Diego team has integrated community partners onto campuses and established a very data-driven practice and process that helps to ensure the efficacy and impact of the services provided over time. So we're going to dive in with some discussion around the program and how it got started. But Yuka, I was hoping we could get started by better understanding your community. If you could walk us through the students and the staff, families that you serve in San Diego, and describe your community for us.
Absolutely. So San Diego Unified is the second largest school district in California. Geographically, we span 354 square miles, so we're quite large and expansive. We serve approximately 95,000 students across 176 schools from grades TK through 12. So given our size, each of our schools are divided into 7 high school clusters. So the high school is kind of the cluster, and then each of the respective feeding elementary and middle schools are divided within those clusters. As far as the demographics of our school community as a whole, we have about 57% of our students can be considered socioeconomically disadvantaged. 17% are English language learners. About 7% are experiencing homelessness. And about 76% of our students identify themselves as a race or ethnicity other than Caucasian. And San Diego also has a unique feature that we are home to several very large military bases. And so we are proudly able to support about 7,400 students with a parent or guardian in the military. So I think given our expansive size, covering kind of the geographical, part of Southern California, but also the number of schools in our district, as you can imagine, the needs of each of our schools and their communities really varies, not just by cluster, meaning like the elementary, middle, and high schools within a certain high school pattern, but also based upon each uniqueness of every school campus. So in developing interventions or developing a service delivery system, we really had to be mindful of ensuring that we met the needs of that particular school, but also as we deliver those services, being mindful of the needs of each respective individual school and family. Sorry, student and family.
That's really helpful context, Yuka. And I know when we last spoke, you shared that the district started the Mental Health Resource Center in 2001, which was really intended to help increase access to services, taking into account the diversity of the schools that you're serving. Can you tell us a little bit about the Mental Health Resource Center, how it got started, and then the types of resources that are available now in its, oh my gosh, how many years has it been? In its 24th, 23rd year in practice?
Sure, absolutely. So as you mentioned, the Mental Health Resource Center was established in 2001 out of a Safe Schools grant, and it really targeted one particular grant, right, in one particular school. And since that, in 23 years, we've grown to about 200 employees, which consist of mental health clinicians, rehab specialists who are paraeducators with extensive mental health experience and backgrounds, community assistants who support our students' families, as well as our administrative support. And I believe that we are unique in saying that our district was innovative in establishing the Mental Health Resource Center, and it's considered, I believe, one of the first school districts in the nation to actually create a mental health specific department. So I think that the innovation that our district potentially has exhibited has been long before this particular partnership. So, but as far as the scope of our services, we as a department, we partner quite a bit with counseling and guidance, who are our school counselors who provide the day-to-day social emotional like learning in our schools. We also partner with school psychs and the school psych department, who are primarily responsible for the IEP-based assessments and supports. And then our department, we provide a large range of services. We, through our county contracted programs, have prevention and early intervention programs where we provide classroom-wide as well as small group services for students in elementary. We also have a middle school kind of universal screener, as well as service delivery model for social emotional curriculum. And we also partner with organizations like Price Philanthropies, who also offers a social emotional curriculum and kind of rigorous service model within some particular schools within our district. What's also unique as a department and as a district is our clinicians who provide IEP-based services. They provide the assessments as well as the treatment services. So I know that many of our district partners also have district clinicians who provide one or the other, but I believe our district is one of those as one of the only districts that provides both. So I think that makes us a little bit unique, but also kind of speaks to like the breadth of services that we provide.
I love that. That's really helpful, and definitely is, it illustrates how robust the services are that are in place across the community. Can you tell us a little bit about, and you shared some of this context as you were describing the different teams that you work with, but how are students and families typically engaging with the Mental Health Resource Center itself? Is that usually through referrals from staff members, or what have you learned to help get families and students connected across such a large population?
Yeah, I think that, the goal really is to kind of have access points across different, in different ways, right? So certainly school referrals and having school site personnel identify students and families that may need support is absolutely one critical way of connecting services. But our teams also do quite a bit of outreach. And so for example, our community assistants are pretty integral in being out in the community. They're trusted members of the community. They help to break through some of the mistrust that may exist that may prevent someone from wanting to access supports. So they're incredibly important. I think the relationships that they maintain with families then permeates, because then they say, oh, well, I my child participated in this program. Why don't you, refer your child? And so then the word of mouth component is very important,
Mm,
and kind of, and having that trust then be um, offered or kind of shared, to kind of how other families to be able to want to maybe speak with us. But I think that, it's a combination of all things. We partner with the parent engagement department, again, other departments within the district, to also try to communicate, our service availability. But I think that really just the trust goes a long way in being visible and just being
mm.
consistent. Um, I think that, when you're able to demonstrate those qualities and integrate yourself into a school culture, families may be more willing to engage than if you were a complete stranger and not necessarily someone that they're familiar with.
I love that. That's really helpful. And I know a little bit later in our conversation, Ashley, we'd love for you to share a little bit about how you've also worked on campuses to help engage families, what that has looked like in practice for the clinicians that you're working with. I think it's such a great point and helpful, Yuka, to hear how many partnerships you're navigating within the district to make sure that you're accessing parents and communicating with parents over a range of different channels as well. About 3 years ago, we started partnering together with Daybreak, the purpose of our partnership was really to help increase access to mental health services in specific clusters of schools in your community. Can you tell us how you sort of first determined the need for the additional services? What were some of the early indicators that you were looking at when you were
Sure.
considering our partnership?
Sure. So the idea of district funded mental health service system really was a concept that was introduced to me by our district leadership. And so they approached our department in the fall of 2021. It's been so long now; it's hard to remember what year we're in. And they wanted to, they recognized that, the mental health needs were already increasing within our school communities prior to the pandemic, and certainly with the pandemic, there's been a greater impact that's, obviously have exacerbated those needs. And so they approached our department about creating a system where all students could have access to mental health services, and not just mental health services, but on-site mental health services, because really it was restricted at that point in time to only those students who had access to our county-funded EPSDT Medi-Cal service provider network, as well as only those students who were eligible for special education and IEP-based mental health services. So that left quite a number of students who would benefit from mental health services and would benefit from them being provided on a school campus where there was convenience, and it helped to break down some of the obstacles to accessing mental health. And so we quickly put together a system where any student across all 176 of our school sites could access mental health services. So we reached out to partners, and kind of within 3 months' time, created these contracts, created partnerships, created kind of an understanding of what the statement of work would look like. And by January of 2022, so about 3 months, we had our first providers being able to provide clinicians in our school sites to be able to support that need. So that naturally is how our partnership began, was and you're being able to meet our district's need to have mental health clinicians available across all of our school campuses.
Very helpful. And I know, Daybreak is one of just several partners that you work with, and one of several partners that is helping to meet the need that you have across the community. One of the things that has really stood out to me and to our team as we've worked with you is the way that you are very sort of systematically integrating the partnerships together with clear communication with schools about what to expect, but also really evaluating partnerships over time. Can you share some of the best practices that you've learned over the last few years around how to appropriately distribute community-based resources across campuses? How do you make some of those decisions? And then how are you assessing the impact of programs over time?
Well, I would hate to say that we've done it well or I've done it well. I can certainly speak to missteps that I've taken, but I think that we have to be data driven, right? And so
Hmm.
when we initially looked to set up this system, we evaluated again. I mean, we have a finite amount of resources. I think I've failed to mention that the funding source of the original district funded service model was the ESSER funds, right? So they're COVID relief
Hmm.
funds, which have since expired in June of 2024. So with the use of the ESSER funds, we had a finite amount of funds and 176 schools and 95,000 students. So,
Hmm.
we had to really take a kind of strategic approach to kind of how we implemented a model that was equitable, but also taking into consideration what other available resources were available. So this system was really intended to be like a supplement to the existing systems that we have in place and the existing supports we have in place, and not to replace. So, and I think that's where you're speaking to, like the level of communication coordination is critical, right? Because the intention is not to take away from or to duplicate anything that our existing providers have in place for us. Um, so we looked at data such as our available resources on campus and really mapped that out to see which schools had what and where they needed more, where were the gaps. We looked at the kind of the percentage or proportion of students with unmet needs, so those who didn't have access to Medi-Cal, who didn't have access to other types of supports that were available on site through grants and other means. We looked at the historical utilization of mental health at the school sites to kind of help us to try to anticipate what the need might be. And so, we looked at all these different data points to again try to create a system that was with the intention of it being as equitable as possible. To ensure that as many students had the ability to access these services in a fair way, as far as with regards to our allocations and how many clinicians we allocate to each respective school cluster. So when I speak with equity, I'm speaking more about just the allocations, right? And I think that the other portion of that is we needed to have very clear expectation of what these services were going to result in, right? What were the outcomes for our
Hmm.
students? So I think we tried to take into consideration just our historical experience, right? And looking at, what we thought a fair number of referrals our students served would be, and then based on that, what we expected the number of, kind of individual services could be expected, groups, referrals, what type of referrals, et cetera, to try to help us to be able to determine if we were hitting the mark with regards to our allocations or if we needed to adjust. And over the years, we started off with 33 clinicians, and then we recognized that our elementary schools had a greater need than we had anticipated. So then we have recently increased our allocations to 47 clinicians across the district, based upon the fact that they were the recognition, right, that the initial allocation was not enough, and that recognizing that there were emerging needs across, different school sites as well as different levels of schooling, and so kind of try to meet that need as a district.
Hmm. That's really helpful. It's helpful to hear what you've taken into account from using the historical data, but then also keeping a pulse on the emerging trends over time. And one of the things I really appreciated about our partnership is the accountability structure that you put in place, which really results in each of our clinicians providing data around the number of students that they're serving, providing more information about where referrals are going, what percentage of those referrals are met on campus, and those that are leveraging community providers as well. And I think, that's provided all of us with a very holistic view of what's happening on the campuses so you can make those ongoing data-driven decisions. Wonderful. I'm going to hand it to Alex Kaiser in just a minute, because I'm also curious, Alex, for your perspective on how you might advise a district who is looking to build up their clinical team as well. But before we make that transition, I had one final question for you, Yuka, which was around sustainability. And you mentioned that ESSER funding has expired. How do you think about sustainably funding mental health services in the same way in the future and moving forward, thinking about, the evolving landscape in California with the fee schedule? How is San Diego considering the future of mental health funding?
Sure. So as a district, we are at this point in time trying to integrate the new fee-for-service model in EPSDT Medi-Cal. At the same time that we're navigating the introduction of CYBHI, the Children Youth Behavioral Health Initiative, which provides an all-payer fee schedule, and that's to help bring on-site services for students with managed care Medi-Cal, as well as for those who are served by their private insurance agencies who also sponsor managed care Medi-Cal programs. So it does still leave us with a number of students like those with TRICARE insurance or students whose parents are maybe reluctant or hesitant to provide their health information to the district being uncovered. But nonetheless, it still offers an opportunity for us to be able to serve an additional number of students who we hadn't been able to serve before. So as we roll out the CYBHI model, service delivery model. We are still working on that, but we are planning to use our existing partnerships with Daybreak and our other our existing district funded providers to help continue to provide the tier 3 services to students. But we're hoping that with the introduction of the CYBHI all-payer fee schedule, that we'll able to then offer a larger breadth of services. So we are also looking to kind of expand, not just in delivering tier 3, but also looking at delivering tier 1 and tier 2 supports, and being able to try to utilize that reimbursement system to try to sustain these services long term, so that we can continue to provide these supports even after the expiration of, for example, the CYBHI starter funds.
Very, very helpful. I appreciate you sharing that context, and we look forward to seeing how it all evolves over time, and especially as more of the tier 1 and tier 2 reimbursements become, realized. I think it's just there's so much potential to reach even more students. So appreciate you sharing that context, and we're excited to be partnering with you along the way. So Alex Kaiser, we're excited that you're joining us today as well, because we have a lot of districts who are also looking to really build out the on-site school-based mental health services that they're providing. And they're looking to do so by building and recruiting their own clinical teams and trying to do that at scale. So we're hoping you might be able to share with our team some high-level tips for districts who are looking to fill these positions, who have historically either felt that there was a lack of candidates in the field, or for whom they may be geographically in a more rural location with fewer available candidates. What advice can you offer our partners?
Yeah, thank you. Absolutely. I think there's really, kind of two steps to that question. And the first one is really defining who is it that you're looking for if you're a district. And while that's not necessarily directly related to getting these therapists into your funnel and into your school, it is related to understanding kind of how we're going to target that therapist. So if I think about the key qualities that we look for, we call the therapists that we find unicorns, because these are therapists who are really challenging to find. They work with kiddos. They have a ton of experience. They've worked within the right settings. They've worked within the right communities. They have the right cultural competencies. And so these are therapists that most districts are probably also going to be looking for, except you're restricted in many ways to these geographical locations. But the other things you're probably looking for would be that flexibility and adaptability, which we are too. You have to meet the kids where they're at, when they're available. And that means that you and your schedule have to be quite flexible to those needs and to the needs of the families as well, if you're doing family sessions or incorporating parents and guardians. Again, the cultural competence is such a large component for us here at Daybreak that we make sure that our therapists have worked in and represent the communities that we are in and that we partner with, that they have a passion for serving those communities as well, and that their education and their experience is going to align. But then once you've defined that, you really have to look at, how do we go find these therapists? And that becomes the more challenging piece, right? I think for districts who struggle, it's really important that you first look at broadening the recruitment channels. So as simple as that is, how can we reach more people with this job just to get a larger number of interests? The most utilized way that I know of and the people I've talked to is really that you want to use those online platforms. And so you want to think about the same way that you might go look for a position is the same way that most therapists are. So they're using job boards, they're on social media, they're in groups with other colleagues who are sharing opportunities. These are the three main places where therapists are looking for positions, again, just like we would. And they're also, looking for referrals. So do they have friends who know of positions, friends who can vouch for a role that they think is a really good fit for this person? So you can bring people in that way as well by expanding your network. You want to partner locally. So that's also looking at universities and training programs near you, or again, going back to that referrals or community mental health organization or other similar organizations that have people that might be ready to transition to the schools or are looking for a new opportunity, and they're perfectly fit for what you're asking them to do. Offering incentives sometimes for the very rural districts, things like relocation assistance, professional development assistance, continuing ed assistance. These are the little things that they're not going to find somewhere else that might push them, to move to your district and to give that a shot. And then there's highlighting the benefits of the community that you work in. I think that's important. Being very proud of that community and helping therapists understand what the role is going to look like by understanding the community. Streamlining the hiring process. So like anything else, take out any friction points, anything that feels like it would be hard, cumbersome. They might just be one click too much for them. You want to remove those pieces, make it easy to apply to your job. And then really push your mission the entire time. I think that's important too. So making sure that at every stage in the process that you're talking to this candidate, that they understand what the mission is and they continue to stay engaged in that, and the two of you are aligned there.
That's really helpful. And I'm wondering if you could share with us some of the interview questions that you would also ask to help evaluate a candidate's fit for a specific community. I really appreciate, how much you have emphasized fit with the community and an interest in genuinely surveying that population. What are some of the questions that you ask to help evaluate that?
Yeah, absolutely. So we asked quite a few questions, but I think there's probably like 4 core questions that would be transferable to any role if you're looking for a therapist specifically. And then beyond questions, there's always clinical evaluations that you can do and assessments as well, which I think are an important part of the process. But if we're thinking just about the interview questions, I think the first and the easiest one probably is to help understand what interests them in working with this district, what brought them to you today, and what is that passion that they have, and how does that align with the kids that they're going to be serving? Obviously, the next one, the one that we kind of all hear in any interview we've ever done, is experience. What is their experience? Can they walk you through that? Specifically, have they had experience within your community? And if not within your community, how about within other communities where the demographics really mirror the community that they're going to be working in? Have they worked with underserved communities and kiddos of those communities? Because that is, in and of itself, its own skill set. I think if we think very specifically to the mental health therapist, we also want to dig into what is that theoretical approach that you use? How does that differ based on the age of the student that you're working with, the circumstances of that student? Does it change when you involve the family? And it should. And really understanding at a core, what type of theoretical approach do you come from? Is it CBT? Is it DBT? Is it family systems? And then what other iterations upon that? Do you use EMDR? Do you use ACT? What other parts of therapy or other additional modalities are you utilizing? And then I think, the last part is really to understand how that therapist is going to think about treating the kiddo. So as much as you can generalize this question, it's, can you walk me through the process of when you first receive a client? What do you do? What's the intake look like for you? What do those ongoing sessions look like in scheduling? And how do you work with the family to ensure the student, stays engaged in therapy, and that the family also is engaged to the extent that that's appropriate or necessary for treatment? And I think finally within that process, if you have a crisis, what are you going to do in that situation? And do you know the community resources that you can reach out to in crisis? And if you can kind of check those 4 boxes, those are the core pieces.
That's really helpful, Alex. I appreciate you sharing some of those suggestions and those tips. I know a lot of our partners right now are actively looking to build up their clinical teams, and this is helpful guidance on some of the qualities to look for and how to evaluate those candidates. Ashley, you've been very involved in helping Daybreak clinicians, and you yourself as a clinician have also been very involved in thinking about how once a clinician joins a school community, really becoming integrated into that community. I'm curious if you could share with our audience today some of the ways that you've seen clinicians or you yourself have really successfully built relationships in the schools that you serve, and what you would be looking for in the clinicians that you're supporting.
Yes. So I think one of the most important things to understand is that every school is going to be its own unique community. Every school is going to do things differently and have different expectations, of you. And they're also going to be serving a different type of community. In all of our schools in San Diego, my clinicians are faced with just very diverse communities given whichever school they are at. And so I think that's the most important thing to remember. And Alex mentioned this as well, is that flexibility piece. And so helping your clinicians understand that that's going to be so important to their day-to-day life. They cannot go to one school and expect things to be the same as it was yesterday at the school they were at, that day. I think the next piece that's hugely important is that open communication with the district and with your referring staff members at each school. So setting up that communication to be consistent and going in, with an open mind. I think sometimes it is really important just to listen and hear the district and understand, okay, what is this school's specific needs, and what does Daybreak or myself as a clinician need to do to meet these needs? And I think that just is going to vary, wherever you are. And so I always tell my clinicians, don't get married to your schedule. Don't get married to one way of doing things, because it usually changes when you're in a different community.
I love that. That's helpful and great advice. What are some of the metrics that you're looking at with clinicians when you're evaluating the services they're providing on a campus? One thing that we often hear from our partners is there may be a wait list that's developing on one campus, or there may be an increase in drop-ins on another campus. What are you looking at with clinicians, and how are you advising them on prioritization, especially when they're serving multiple campuses in a given week?
Yeah, there's a couple of things that I do look at and keep my eye on throughout the school year. One is their caseload and how it's ebbing and flowing. And so it's like, do we have a school that's not referring? And so why are they not referring? Are they not referring because they don't fully understand our process? Is it a new staff this year and they're not familiar with Daybreak? So do we need to go back and provide some education for them? Do we need to make it clear, which students we serve? And so also kind of taking a look at that, and then also, do they have other services, on campus? Is this going to be a school that might always be a little bit lower referring to us because they do have different services there? And so looking at the big picture, it's like if I have one clinician who has a few schools that are, low referring, where can I move them or allocate them to a school who might be higher referring or might have students who are higher priority? I think additionally, when we have, a wait list too, again, what can I do about that? So can I reallocate a different clinician, or can we, look at trends? It looks like, oh, this school is referring a lot of kiddos for social skills. Okay, so maybe we could create a small group and get some of those kiddos into care more quickly. And then if they still need individual services when the group is finished, we can reevaluate, but at least we're getting them into care and we're working through that wait list.
Very, very, very helpful. Thank you. All right. We have about 5 minutes left, and I'm curious from our audience if there are any questions for our panelists today for Yuka, Alex, or Ashley. And we can monitor the chat in case there are any questions. Or if our panelists have questions for one another, you're also welcome to jump in and ask.
Okay, well, I have a question. Ashley, It was really helpful to hear about kind of allocating these different clinicians to handle a wait list. So could you, I love that idea of like, okay, let's start a group if we see this kind of skyrocketing trend, and we know we can't get every single kid into, specialized care at a time. How would that transition look? Like what would it be like to like start that group and then get into care, and what are you doing to kind of monitor the progress that's made from that first step to the next step?
Yeah, so I think it goes back again to communication with that district. And so, if you are having that wait list with them, so problem solving with them. So, okay, I see that you referred A, B, and C kiddo for this. Those are very similar presenting problems, and those kiddos are of the same age. How do you feel about putting them in a group? Do you think that they're fit for group? And so, usually it's a yes. And so then we would move forward with the same process as, getting consent, letting the parents know the kiddos are starting that group. And then, that clinician is going to be kind of keeping their eye open as the group is progressing. And, is this group helpful for this kid? Is this child making progress and showing strides? Or sometimes it's really easy to pinpoint, this is a kiddo that is going to need that individualized care. And so again, communicating that with the school. And so, when the group is finished or the next time that there's an open spot for that individual services, getting that kid into that care.
Well, thank you. Well, I am not seeing any questions in the chat, so I have a final question for Yuka. Just with everything that you've talked about and how robust the Mental Health Resource Center is, I just would love to hear if you could name what you're most proud of in the work that you've done.
Well, thanks for asking that question. I think that honestly, I'm most proud of our district just continuing to put students and families first, and continuing to find ways to support them. And obviously, in creating this system, um, it represents that, right? And so, I'm super proud that they entrusted our department with this work. But I think I'm most proud of the staff in our department. I think I'll speak first to our staff, but also to our partners. But this has been a challenging 4 years for everyone, and I know our teams work tirelessly. I know they self-sacrifice, but they are always present for students and families. And I really, really cannot speak to how proud I am of them and just how well and effectively they work with families and students. And so, and that also extends to our partnerships with your clinicians. And Ashley, like, this is the first time we've met in Zoom, but it's very nice to finally meet you because I only hear great things about you um, from our partnering school sites. So thank you all as well, because I know that you help to support our needs in the midst of the pandemic and workforce shortages. And as Alex, you mentioned, it was a difficult find, a difficult ask to try to find all of these clinicians in a time where there was very few that were available. And so I very much appreciate that, just all the tireless work, right? That it takes a village, and I appreciate that you're part of our village.
Thanks, Yuka.
Very well said. And we're, again, just very, very honored to work with you and most importantly, to have learned from you over the last few years. And we're excited to continue learning together as we go into this next, I like to think of it as like the next post-ESSER world, where we're sort of mapping out resourcing again. And to your point, putting families and students at the forefront of all of the decisions that we're making. And appreciate your partnership and, being a model of that as a district and as a partner.
Well,
So
thank you.
thank you. Thank you for being here and sharing your learnings with our audience. And Ashley and Alex, thank you both for being here as well and sharing some tips and advice with other leaders. And we're all in it together, and definitely takes a village. So thank you all so much.